the outreach that we are doing to these smaller hospitals, when I tell you there's some that just no one cares about, and offering to check on their patients for them means a lot to them, because you never know who is coming through your door. And I would say from a mission standpoint, I think it's a responsibility for us to try to help a lot of these communities, because we need them to be successful.
Welcome to Straight from the Source, a podcast from FMOL Health. Here, healthcare is a verb. It's how we show up every day, boldly, joyfully, and with great love. You'll hear real conversations with our real experts, the people who healthcare every day. Our goal is simple: to bring you connection, clarity, and context straight from the experts you can trust. Because healthcare isn't just something we provide, it's something we do. Today, we're excited to welcome Dave Estorge, Vice President of Rural Strategy at FMOL Health, and Dr. Emilio Russo with LSU and the Rural Family Medicine Residency Program at Our Lady of the Angels Hospital, to share about their work and its importance to our region and our health system. Welcome, Dr. Russo and Dave. Glad that you guys could be with us.
Thank you for having us.
Yeah. So, Dr. Russo, you want to kick us off?
Well, I've been a part of FMOL Health for, I guess, about 12 years now. And my days have changed substantially during that period. Presently, I'm the chair of the Department of Family Medicine at LSU. So happy to be here and be a part of this conversation.
Yeah, we're glad to have you. Dave, what about you?
Well, I started with FMOL Health in January 4th of 2021, and I've held a number of roles since I entered our ministry. But most of my day now is focused on outreach to our rural health partners, the hospitals that are transferring us patients every day. Our main focus for this job is to say yes to hospitals who want to transfer patients to us, and then talk about how we can get them back to their communities to recover. And so if we're able to do that, we're able to elevate the care in those communities and provide a safe spot for these patients to recover. It's always good to be closer to home, closer to family. And those are some of the things that we're working on right now.
Yeah, it's meaningful work to ensure people have the access to not only care, but the best care possible, right? And so I think that's a big driver, especially when we talk about rural health, which is really our main topic and focus today. So I'm interested in what does rural health mean to you, and what does that mean, and why does it matter so much right now?
I have probably been in, I would say, 40 to 45 hospitals in Louisiana and Mississippi over the past 8 months. And I can tell you that these hospitals are the backbone of their community. They're often the largest employer in their community. And the ties that run through those hospitals are inspiring to me. It is not uncommon to have the CEO of the hospital born in the hospital that they're now running. It's not uncommon for one of the employees to walk down the hall and be working with several of their family members. It's very common for you to be taking care of your friends, neighbors, and relatives in your community hospital. And so from my standpoint, with FMOL Health, we have a responsibility to be that tertiary care facility for these hospitals, but not have a relationship with them that is predatory. We have a responsibility to be an extension of the care that they received at their community hospital. So every day, I go through transfer lists in every market, and I send an email to the CEO of these hospitals and say, just wanted to say thank you for the transfer. This is the patients or list of patients. Please take a look at this list and let me know if there's anyone that you would like for us to visit for you on your behalf. And the next part of that email is, please connect me with your swing bed coordinator so we can develop a pipeline to where we can return that patient back to your hospital for them to recover around their family and friends. If we're able to do this correctly, and we are doing better, we're going to be able to solve probably 20 to 25% of the rural hospital financial issues that exist by sending the patients that they send to us back to their communities to recover. Mm-hmm. The stories that I have received and the emails that I've received back, they're quite puzzling. The CEOs will get these emails and be like, what is going on here? I've never received an email like this before. Then they'll get used to receiving them, and then they'll start engaging, and they'll say, that individual is my pastor. Would you please go check on him? Mm-hmm. That individual worked at our hospital for 14 years. They're like family. Would you please tell them I said hello and put eyes on them? I have so many stories about this. But creating that type of connection with those hospitals is especially meaningful. And once you do that, the next step is, I really like these guys. What else can we work on together? Because we align with them from a mission, vision, and value standpoint.
Yeah, that's a wonderful answer. And I know we call ourselves a ministry of relationships, and it really is. And I think we say that, but it's lived out every day, right? And it's wonderful to hear that even when these patients come from us from other facilities, we still are valuing the relationships they have with their community hospital, but then also their families and what is best for them personally in healing. So Dr. Russo, any other thoughts you have about rural strategy and why it's really important that is cared for?
Yeah, I think on the one hand, when we think about rural healthcare, we often think about disparity. We think about barriers to access, economics, outcomes, and frankly, in Louisiana, perhaps we ought to think about a crisis. And yet my knee-jerk response to what is rural healthcare or what is the strategy that need best be applied sort of reminds me of a quote that I love by Wendell Berry. And he said this, health is membership. And so I think the solution to rural health care is right in front of us. It's exactly what he said. It's relationships. And I mean that not in some sort of cliche or appropriately Franciscan way. I think practically, when you look at health outcomes, there's a reason why primary care is the only thing associated with improved outcomes and decreased costs, because it's our relationships that help us leverage the best outcomes for patients and their families, whether it's a day in the office or transferring them back to the community so that they can recover and grow together. Mm-hmm. Health is membership. I would say health is relationship.
Yeah, absolutely. I think that's key in knowing that we have those strong connections, right? And we talk a little, you mentioned, both of you, some of the challenges, right, with rural health and the challenges that rural communities face every day, just especially from access, right? But can you dive a little deeper into that? What are some of those challenges you're seeing in those communities and how we're kind of building bridges to help?
Yeah, so it wasn't too long ago that a lot of these small communities had a general surgeon and some, I would say, lower acuity specialists. But they lost the ability to recruit to their markets. And so when those physicians aged out, they lost a service to the community. There are a lot of hospitals currently that are so thin. Additionally, and again, I'll go back 10 years, you had a lot of hospitals who were much more comfortable keeping patients in their hospital. Transfers have become, I would say, easier because we've all gotten better at accepting patients. And so it's a lot easier for these hospitals to press the transfer button and for us to receive the patient. What we are actually starting to have conversations with hospitals who were sending us a lot of patients is this. Here's the list of patients that you sent us. What do you need to have in your hospital to make you more comfortable with keeping these patients? Because we don't want everything that you're trying to send us. It's better for your hospital and for your community to keep these patients there. Mm-hmm. So as we deepen the relationships with these hospitals, that's going to be the next iteration of whether it's a relationship through telehealth or coverage in their community. How can we help some of these hospitals that are sending us a lot of patients keep more of their patients in their community? We need to, especially in, I would say, the Baton Rouge market, St. Dominic and St. Francis, even in Lafayette, we have got to do a better job of reserving our beds for the sickest of the sick in our state. Those hospitals have unique capabilities. They have the ability to do things that very few hospitals in their states can do.
It's a great explanation. Anything you'd add to that, Dr. Russo?
I think that, number one, I've been a physician on that transferring side, trying to find the care that the patient needs, because in the community we didn't have it. I've also been a part of those sometimes contentious discussions about the perspectives on, does the patient need to go or does the patient need to stay? And I think that usually I'm looking for a resource that's not a parish away or half an hour away. I'm looking for a resource that is Our Lady of the Lake or St. Dominic's. And so I love the comment about being mindful proactively about this being a resource for our state and not just thinking of it as another bed for our system. I think that perspective, that approach is so needed, not just in our system, but across the state.
I'm interested in both of your perspectives on how the mission of FMOL Health guides our approach to this and to helping to solve these problems, and how does our mission guide how we serve our rural communities?
I think from the beginning, when I was asked to do this job, my first comment was, if we're going to be successful, we're going to bring the best of our mission and the best of our clinical expertise to these rural communities. And so I can speak as to how it guides my workflow every day. I truly believe that the Lord guides our steps, and if we're attentive, He puts us in places intentionally so that we can be of service to Him. And I think the outreach that we are doing to these smaller hospitals, when I tell you there's some that just no one cares about, and offering to check on their patients for them means a lot to them, because you never know who is coming through your door. And I would say, from a mission standpoint, I think it's a responsibility for us to try to help a lot of these communities, because we need them to be successful. And it's not just about providing specialist care and referrals. There's a hospital that we're talking to right now that lost their supply chain director. So go try to find a supply chain person in a town of 2,000 people that's got healthcare experience. Mm-hmm. What we did, though, is we executed a small contract with this facility and dedicated one of our resources 20 hours a week to train someone without healthcare experience in how we handle supply chain. That's a very small thing of what we are doing with some of these hospitals.
Yeah, that's great to hear. I think that's the critical piece, is how do we support them in the moment, but they also have to continue to thrive. And Dr. Russo, I'm curious on your perspective in our mission guiding this work.
Circling back to the idea that health is about being able to live in right relationship with the world around you and with the people you care about. Sometimes in training residents for rural context, for rural places that may be vulnerable, that may represent resource limitation, part of what we found is that being connected to the community outside of the exam room is a really key part of our role as a physician. That is easily lost in a large urban place. That is easily lost in a tertiary care center, not for lack of mission, interest, or incredible team of administrators, but because of simply the size. And so this is something that we've had lots of opportunity to kind of be creative and be missional, so to speak, that we could have never done without the support of Our Lady of the Angels and the administrative team at that hospital that's part of FMOL Health.
Yeah, that's wonderful. I'm glad that connection is resonating and carrying through. Well, Dave, this question's for you. Can you tell us a little bit about your rural health strategy and what are 3 main goals that we're trying to achieve within that?
Yeah, so I think number 1, across our health system, improve our acceptance rate of transfers that are requested to our hospitals. That's number 1. I would say number 2, increase our referrals to swing beds to the hospitals that transfer patients to us. So they can have the benefit of receiving that patient, and that patient can recover back in their community. I would say the third would be to improve upon the relationships that we have and the trust that we have with these hospitals. You have to understand, FMOL Health is a big health system, and there isn't always the greatest amount of trust for us when we go into another hospital. And so we have to be very mindful of that. And so I think the outreach that we're taking by, 1, thanking them, letting them know how critical they are, and then 2, trying to send the patients back. And I think the third thing really, on top of building the trust, is working with these individual hospitals to develop the ability for them to care for more patients in their community. Those are the 3 things from my perspective. If you can do those 3 things, I would say it's just going to be an overwhelming success, because nobody's doing this work the way we are.
Mm-hmm. It's our unique take on it, right?
Yeah.
Our unique approach. And so you kind of talked about this a little bit on our system's footprint, right? And how along that I-10, I-12 corridor, how we're helping to connect care across Louisiana and Mississippi with our presence there and the work we're doing.
Yeah, it's actually fantastic. I would say July 1st, we went live with an I-20 transfer center. And so for the first time, become really acting like a system in utilizing the resources to serve our respective communities, it has been incredible. You can look at the Jackson market's growth from patients from Northeast Louisiana is up 344% year over year in terms of the number of patients that are coming from that area. And so With that said, it also creates some unique challenges. You have patients. We have a patient in the Jackson market right now from a hospital that is 3 hours away. That is inconvenient for the family. That is inconvenient for the patient in a lot of cases. But guess what happened? They called probably 3 or 4 other hospitals, as you've probably done before, my friend. No one was available, so they said, yes, I will take that bed. Mm-hmm. That's what we have created really starting this fiscal year. And by treating our health system as a group of beds, as opposed to individual markets disconnected from each other, we are in a much, much better position to serve our states than we ever have before. Mm-hmm. And it's been incredible to watch.
Yeah, absolutely. Well, and it also is that was going to be my follow-up question is this, we have a different array of listeners, right? From hospitals and patients and people who have no kind of frame of reference for some of this. And so can you talk a little bit about the experience of the patient? They're not initiating these transfers, right? It's their care team and we're doing what we can to make it as seamless for them as possible, right? On our side.
The game has officially changed. Really effective July 1. This has been going on in Baton Rouge for so many years just because of the wonderful services that Our Lady of the Lake, for example, can provide. They're getting patients from all over. Mm-hmm. But I know you've been in a responsibility where you're trying to get a bed and you really don't want to send them, 3 hours away, but it's safer sometimes to do that, right?
No question. And for me, as working in the hospital and in the outpatient setting, I'm the person that they trust. Mm-hmm. I'm the person that they look to. They're not asking the person they've never met before some of the questions they'll ask me, even when I may not be the expert in that conversation. And so when it becomes necessary for a patient and often their family to go hundreds of miles potentially away from home in a moment where they're truly vulnerable, as was mentioned so accurately, this deserves our best effort, our most attentive care. And so when the process is easy, it gives the physician, the hospital team, the administrators the ability to be present and to deliver the care these families deserve.
Yeah, absolutely. That's really great to hear. And it sounds like our transfer center and our transfer center strategy is really, become an essential part of caring for our patients. And so that's really what I want to dive into a little deeper is, can you talk about why it's so critical for patient outcomes that we treat this with care and really have a strong strategy in place, and then how our partnerships as FMOL Health really play an important piece in strengthening care in these communities?
Yeah, so I would say, again, this all begins with acceptance. I have to tell you this quick story. So I was in a hospital meeting with an ER physician in a rural area, and I asked him, how are things going when you transfer a patient to us? He said, well, I need you to accept more of our patients. And I said, what are you talking about? I said, we've accepted more than 60% of the patients that you've sent us. He said, you're not counting the time that I call you, ask you if I have a bed, you say no, and I hang up. I was like, rats. So that day, made a call to our transfer center director on the I-20 corridor, Dan Woods, does a great job. And I said, dude, can we stop saying we don't have beds? He said, well, yeah, what do you mean? I said, let's not do the auto accept the patient and have the patient sit in the ED for 3 days, but we said we're going to accept them. Let's put them on a callback list and let's call them back and update them on how our beds are moving throughout the day. because we know at certain times when our discharges are going to happen. So we know in a lot of cases, by the time these hospitals package a patient up and send them to us, we're going to have a bed available, because it takes that long to get a patient to you sometimes. We implemented that callback list the next day, and we began to accept an extra patient per day based on, think about what that means to those communities.
Yeah.
And this goes back, and what we are hearing from these hospitals, thank you for what you're doing for us. And so that just means a lot.
Yeah, partnership, right?
It truly does.
Yeah.
It's the socioeconomic factors.
Mm-hmm.
I'm going to let you talk about that.
Yeah, I see you nodding, Dr. Russo. What are your thoughts?
I think that as it relates to the sort of complex things that drive disease, we have, as of late, finally, as though we weren't all part of the human race and didn't come from a home that wasn't a town and had a mama and a daddy and brothers and sisters and all the things our patients face. So now we realize quite clearly, and we've drawing a line from where we wake up, where we go to school, where we go to sleep, where we work, and how that is critically important to our health trajectory from, honestly, before we're even born. But we didn't have any way to really operationalize that. We haven't ever known, and we still really, on a large scale, do it very well in the United States, of how to incorporate those realities into delivery models, into development models, into policy. But there's no doubt that when someone is being discharged from a hospital, especially if they were transferred, the complexities and the opportunity for things to fall through the cracks come beautifully and horribly into view. To say nothing of what it would mean to cross state lines, to utilize a separate health record, to have a different payer source that may not have traveled with the patient as easily as the bill. All those things bring into relief how difficult the task is, how key not just accepting the patient is, but navigating every step along the way for the patient and family to get them to those necessary resources, both at home and sometimes out of town. And I think how we envision for Louisiana, for Mississippi, different ways. We don't just need more resources. We don't just need more of the same. We need innovation. We need collaboration. We need people like my colleague here who think about their health system as a resource for their state and their communities, not just a system for which we can leverage brand identity and keep everything inside the camp. So I'm encouraged by this. I'm cautiously optimistic.
Absolutely. It's definitely a challenge, and we know that we're focused on getting it right and in that collaboration. We also know it's not just about the medical care they receive, it's about how we support their families too. And so, Dave, I'm curious about, and I'd love to hear your take on the Hogs for the Cause Family Support Home at the FMOL Health Our Lady of the Lake Children's Hospital, and the similar family accommodations that we have across the system, and how they really make a difference for when we do, receive patients who are out of town or need that support.
The accommodations, like as you mentioned with our children's hospital, when you come into an area that you're not familiar with, you're typically coming from a smaller town. You're typically coming from, and you live in a small town for a variety of reasons. You don't want to live in a big town. You don't want to go to your metropolitan area, your capital city. But now you're forced to. And so the things that we have put in place in the Baton Rouge market in particular to help these families feel more at home is incredible. You have to take the stress off of these families when they travel for care. And so the first barrier is financial. The fact that you're able to provide this type of service, I think, is a tremendous gift to that family. That eliminates one factor of it, right? And so if you have mom and dad, brother, sister, aunt, uncle, whoever the care team is, less stressed, that is going to produce a better healing environment for that patient.
So Dr. Russo, Our Lady of the Angels has really become a model for rural healthcare excellence. Can you talk about and share more about the LSU Rural Family Medicine residency program and all of the great work that you're doing at Our Lady of the Angels Hospital, and how that really strengthens local care, builds the next generation of physicians, and ultimately is making a difference in Washington Parish and Bogalusa for those patients?
Yeah, thanks for that question. I want to connect my answer to your first question and to the story of not just how, but why I'm in Bogalusa, why I still love to go to Our Lady of the Angels. And it's not so much the work that I'm doing, but the incredible collaboration that exists there and has evolved in the last 11 years or so since the partnership between the state and FMOL Health emerged and has grown and evolved. The residency program that's there is really remarkable, certainly still, but even more so when FMOL came to Bogalusa. When it comes to training family physicians, and we know that when you look at market size all over the country, there's only one specialty that sort of disperses like the population, that regardless of market size, family physicians are in every market. You have to start to get to markets greater than about 200,000 to start to see a higher concentration of other specialists. And so training family physicians has always been about connecting that training to the community in which they will subsequently find themselves, right sizing the training and making the training specific. Because the challenge of family medicine is it's diverse. It doesn't matter your age, doesn't matter your gender, doesn't matter your problem. And so it's a tall task. And so this training was going on when FMOL Health came to Bogalusa, and it was very, very tenuous for us as to how that would continue, or frankly, if it would continue. But going back to the vision of the sisters at the time, they saw a hospital there that was large enough to continue to offer regional value, small enough to support the kind of comprehensive, excellent care and training for these family medicine residents, and to leverage all that in one operation that offered benefit to a community that really, really needed it. And so I've gotten to be a part of this for a number of years and have seen just the way that that training, which is usually in a rural place, connected to a very small hospital. You only have one or two residents who for 2 or 3 years go and work in that small hospital. But in Bogalusa, they don't start in New Orleans or Baton Rouge. They start there and they finish there. And that is really, really important. And the support that this program offers to a small hospital, allowing it to deliver not just care, but care that's excellent and at least as good as some larger facilities. It's really quite incredible. And we could never have continued to do it without not just the collaboration that FMOL Health brought, but the investment And so FMOL brought a commitment. They brought missional values that were in step with LSU, and they brought expertise that have allowed us to continue to be ourselves, to evolve into a resource that's trusted, and to have a vision for how we can continue to do this in the future.
Yeah, that's wonderful. Well, and I know that for the people in that community, that is really the closest place to receive care, right? And to Dave's point earlier, it's a source of a job for that community, right? One of the biggest employers. And so any patient stories, patient outcomes, I'm sure you see so many of how Our Lady of the Angels, and in particular the work you're leading with the Rural Family Medicine Program is impacted for the better.
I really love that you brought this back to people.
Yeah.
Because that's what makes Bogalusa great. I often said when we're recruiting residents, and this will come as a shock, I'm sure, to our listeners, if they're in any way familiar with Southeast Louisiana, not everyone is signing up to come to Bogalusa. I guess it goes back to the if you know idea. But because of that, the people who do come are committed not just to the type of family medicine, the type of training, the type of care that we have prioritized, but they're committed to this symbiosis between FMOL Health, Our Lady of the Angels, LSU, and the community itself. I would argue that the best faculty member I've ever had is Bogalusa. And the people that live there and the way they have embraced us, trusted us, and made us a part of their story and themselves a part of our own.
Well, I'm curious, what's next for rural health, for FMOL Health? What are biggest opportunities? What excites you about the future in this space of rural healthcare?
We have to continue to build relationships with these hospitals and be genuine and authentic in our approach. When they begin to understand that we need them to be successful in their community, and these are the ways that we think we can help them, and we continue to show up, that's when you build trust. When you build trust, then the outreach starts to come back and flow in the opposite direction. You become their first call, not just for their transfers, but for, I have a problem. I'm losing my HR director at the end of this week. And if my HR director leaves, my CFO is probably going to leave too. Is there anything you can do to help? The calls are coming more and more frequently. It's gone from no one calling me and us to us getting calls almost every day for help in some sort of fashion. So that's what I'm most excited about, because in a lot of ways, these are not big asks. These are things that we should be doing as a matter of workflow. And so that's what I'm looking forward to, is deepening the connections between our facilities, our employees, and these rural hospitals. I just look at my role as being the bridge between it.
Dr. Russo, anything in this space that you're looking forward to, excites you about the future?
I think that for me, having had the privilege to work in resource-limited communities, in fact, that was what I wanted to do for my entire career. It often felt like, I was tilting at windmills and was always looking for someone who would listen. And lately, it feels like maybe we're getting the message in Louisiana in a new way. Not just, yes, the sky is falling, but that we have to think of this differently. It is clear we've spent more money than anyone could ever imagine, and we haven't been successful. That's just facts. And it's not just Louisiana. When I sort of circle back to Our Lady of the Angels, to Bogalusa, I'm encouraged by the people that I work with every day who are committed to the things we're talking about. And I think if we can continue to build trust on every level, that then will change the conversation and maybe change the outcomes.
Well, is there anything else, we're coming to a close of our time today, that you'd want to share with our listeners about rural health? Anything else we can wrap up with?
I think that if I had something else to add, it would be, I think it's critical that we enlist the expertise of those communities, those rural communities, in finding actual solutions, in identifying the needs that they have, in this sort of public health approach, so to speak, to making an impact across rural Louisiana and rural Mississippi. Not just building those connections, but really listening, because I think that somehow they have an important part of the answer. And I know it's easy sometimes to not include that in the kind of construct of how we keep getting better, how we grow, how we improve people's health.
Anything you add, Dave?
Yeah, I'm just excited about the opportunities that are in front of us. There's just a lot of need in these rural communities, and I consider it a blessing to be a part of this ministry and to be able to do this work each and every day.
Absolutely. Well, thank you both for the work you do, the impact you're making in our communities, and for being here and sharing.
Thank you.
Thanks for having us.
And all our viewers and listeners, thanks for tuning in. We'll have helpful resources linked in the show notes. We'll be back again soon with more episodes of Straight from the Source, a podcast from FMOL Health. If you have ideas for topics you'd like to hear on the show, email us at podcast@fmolhs.org. Thanks for listening.